Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A patient who has sickle cell disease is admitted with vaso-occlusive crisis and reports severe abdominal and flank pain. Which of the analgesic medications on the pain treatment protocol will be best for the nurse to administer initially? 1. Ibuprofen 800 mg PO. 2. Morphine sulfate 4 mg IV. 3. Hydromorphone liquid 5 mg PO. 4. Fentanyl 25 micrograms per hour transdermal patch. The correct answer is 2. Morphine sulfate 4 mg IV. Guidelines for the management of vaso-occlusive crisis suggest the rapid use of parenteral opioids for patients who have moderate to severe pain. The other medications may also be appropriate for the patient as the crisis resolves, but are not the best choice for rapid treatment of severe pain. A nurse is caring for a client who has just returned from surgery to treat a fractured mandible. Which of the following items should always be available at this client's bedside? Select all that apply. 1. Nasogastric tube. 2. Wire cutters. 3. Oxygen cannula. 4. Suction equipment. 5. Code cart. The correct answers are 2. Wire cutters and 4. Suction equipment. Following surgery for a fractured mandible, the client's jaws will be wired. The nurse should be prepared to intervene quickly in case the client develops respiratory distress or begins to choke or vomit. Wire cutters or scissors should always be available in case the wires need to be cut in a medical emergency. Suction equipment should be available to help clear the client's airway if necessary. It is not necessary to keep a nasogastric tube or oxygen cannula at the client's bedside. Cardiopulmonary arrest is unlikely, so a code cart is not needed at the bedside. A client refuses to look at or care for her colostomy. Which of the following statements by the nurse would be most appropriate? 1. It has been 4 days since your surgery, and you will soon be discharged. You have to learn to care for your colostomy before you leave the hospital. 2. I think we will need to teach your husband to care for your colostomy if you are not going to be able to do it. 3. I understand how you are feeling. It is important for you to feel attractive, and you think having a colostomy changes your attractiveness. 4. I can see that you are upset. Would you like to share your concerns with me? The correct answer is 4. I can see that you are upset. Would you like to share your concerns with me? It is important for the nurse to recognize that individuals go through a grieving process when adjusting to a colostomy. The nurse should be accepting and provide the client with opportunities to share her concerns and feelings when she is ready. Lecturing the client about the need to learn how to care for the colostomy is not productive, nor is attempting to shame her into caring for the colostomy by implying her husband will have to provide the care if she does not. It is not possible for the nurse to understand what the client is feeling.
When giving discharge instructions to the client with vasospastic disorder, Rationale's phenomenon, the nurse should explain that the expected outcome of taking a beta-adrenergic blocking medication is to control the symptoms by 1. Decreasing the influence of the sympathetic nervous system on the tissues in the hands and feet. 2. Decreasing the pain by producing analgesia. 3. Increasing the blood supply to the affected area. 4. Increasing monoamine oxidase. The correct answer is 1. Beta-adrenergic medications block the beta-adrenergic receptors. Therefore, the expected outcome of the medication is to decrease the influence of the sympathetic nervous system on the blood vessels in the hands. Beta-adrenergic blockers have no analgesic effects. Increasing blood supply to the affected area is an indirect effect of beta-adrenergic blockers. They do not increase monoamine oxidase, which does not play a role in Raynaud's disease. A patient with a fractured fibula is receiving skeletal traction and has skeletal pins in place. What would the nurse instruct the assistive personnel to report immediately? 1. The patient wants to change position in bed. 2. There is a small amount of clear fluid at the pin sites. 3. The traction weights are resting on the floor. 4. The patient reports pain and muscle spasm. The correct answer is 3. The traction weights are resting on the floor. Rationale. When the weights are resting on the floor, they are not exerting pulling force to provide reduction and alignment or to prevent muscle spasm. The weights should always hang freely. Attending the weights may reduce the patient's pain and spasms. With skeletal pins, a small amount of clear fluid drainage is expected. It is important to inspect the traction system after a patient changes position because position changes may alter the traction.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The client diagnosed with a myocardial infarction is receiving thrombolytic therapy. Which data warrants immediate intervention by the nurse? 1. The client's telemetry has reperfusion dysrhythmias. 2. The client is oozing blood from the IV site. 3. The client is alert and oriented to date, time, and place. 4. The client has no signs of infiltration at the insertion site. The correct answer is 2. The client is oozing blood from the IV site. Any bleeding from the IV site, gums, rectum, or vagina should be reported to the HCP. The HCP may not be able to take intervention to prevent the bleeding during therapy, but it warrants notifying the HCP. The nurse is preparing to administer medications in the antepartum unit. Which medication should the nurse question administering? 1. Terbutaline to a client preparing for an external cephalic version. 2. Hydralazine to a client diagnosed with preeclampsia. 3. Methotrexate to a client with an ectopic pregnancy. 4. Prochlorperazine to a client diagnosed with hyperemesis gravidarum. The correct answer is 4. Prochlorperazine to a client diagnosed with hyperemesis gravidarum. Prochlorperazine is contraindicated in pregnancy. Ondansetron and promethazine are more common medications for nausea and vomiting in pregnancy. Terbutaline can be administered to the client preparing for an external version to relax the uterine muscle for manipulation of the fetus. Hydralazine is commonly used for elevated blood pressure in pregnancy. Methotrexate, a folic acid antagonist, is used for medical management of an early ectopic pregnancy with an intact fallopian tube. The charge nurse on a surgical floor is making assignments. Which client should be assigned to the most experienced nurse? 1. The 36-year-old client who has undergone an antral irrigation for sinusitis yesterday and has moderate pain. 2. The 6-year-old client scheduled for a tonsillectomy and adenoidectomy this morning who will not swallow medication. 3. The 18-year-old client who had a Caldwell-Luke procedure 3 days ago and has purulent drainage on the drip pad. 4. The 45-year-old client diagnosed with a peritonsillar abscess who requires IVPB antibiotic therapy 4 times a day. The correct answer is 3. The 18-year-old client who had a Caldwell-Luke procedure 3 days ago and has purulent drainage on the drip pad. The post-operative client with purulent drainage could be developing an infection. The experienced nurse would be needed to assess and monitor the client's condition. Any nurse who is capable of administering IVPB medications can care for this client. This client is 1 day post-operative and has moderate pain, which is to be expected after surgery. A less experienced nurse can care for this client. A child about to go to surgery involving the throat area can be expected to have painful swallowing. This does not require the most experienced nurse. In this type of question, you must determine if the situation described is expected or within normal limits. The option that gives unexpected data or data not within normal limits requires a nurse with more knowledge and experience.
If the client displays risk factors for coronary artery disease, such as smoking cigarettes, eating a diet high in saturated fat, or leading a sedentary lifestyle, techniques of behavior modification may be used to help the client change the behavior. The nurse can best reinforce new adaptive behaviors by 1. Explaining how the risk factor behavior leads to poor health. 2. Withholding praise until the new behavior is well established. 3. Rewarding the client whenever the acceptable behavior is performed. 4. Instilling mild fear into the client to extinguish the behavior. The correct answer is 3. rewarding the client whenever the acceptable behavior is performed. Rationale. A basic principle of behavior modification is that behavior that is learned and continued is behavior that has been rewarded. Other reinforcement techniques have not been found to be as effective as reward.
The nurse is making a room assignment for a newly arrived patient whose laboratory test results indicate pancytopenia. Which patient will be the best roommate for the new patient? 1. Patient with digoxin toxicity. 2. Patient with viral pneumonia. 3. Patient with shingles. 4. Patient with cellulitis. The correct answer is 1. Patient with digoxin toxicity. Patients with pancytopenia are at higher risk for infection. The patient with digoxin toxicity presents the least risk of infecting the new patient. Viral pneumonia, shingles, and cellulitis are infectious processes. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A nurse teaches a client experiencing heartburn to take 1.5 ounces of Mulox when symptoms appear. How many milliliters should the client take? Blank milliliters. The correct answer is 45 milliliters. 1 ounce equals to 30 milliliters. To solve this problem, you set up the formula as 1 ounce over 30 milliliters equals to 1.5 ounces over x. You cross-multiply 1 times x and 30 times 1.5. You get 1x equals to 45. You divide by 1 on both sides, and you get x equals to 45 milliliters. When planning diet teaching for the client with a colostomy, the nurse should develop a plan that emphasizes which of the following dietary instructions. 1. Foods containing roughage should not be eaten. 2. Liquids are best limited to prevent diarrhea. 3. Clients should experiment to find the diet that is best for them. 4. A high-fiber diet will produce a regular passage of stool. The correct answer is 3. Clients should experiment to find the diet that is best for them. It is best to adjust the diet of a client with a colostomy in a manner that suits the client rather than trying special diets. Severe restriction of roughage is not recommended. The client is encouraged to drink 2 to 3 liters of fluid per day. A high-fiber diet may produce loose stools.
Which safety measures will be most important to implement when caring for a client who is receiving 2 units of packed red blood cells? Select all that apply. 1. Verify that the ABO and RH of the 2 units are the same. 2. Infuse a unit of PRBCs in less than 4 hours. 3. Stop the transfusion if a reaction occurs, but keep the line open. 4. Take vital signs every 15 minutes while the unit is transfusing. 5. Inspect the blood bag for leaks, abnormal color, and clots. 6. Use a 22-gauge catheter for optimal flow of a blood transfusion. The correct answers are 2, 3, and 5. The American Association of Blood Banks and Canadian Blood Services recommend that 2 qualified people, such as 2 licensed nurses, compare the name and number on the identification bracelet with the tag on the blood bag. Verifying that the 2 units are the same is not a recommendation. Rather, the verification is always with the client, not with bags of blood. A unit of blood should infuse in 4 hours or less to avoid the risk of septicemia, since no preservatives are used. When a blood transfusion reaction occurs, the blood transfusion should be stopped immediately, but the 4 lines should be kept open so that emergency medications and fluids can be administered. The unit of PRBC should be inspected for contamination by looking for leaks, abnormal color, clots, and excessive air bubbles. When a unit of PRBCs is being transfused, vital signs are assessed before the transfusion begins, after the first 15 minutes, and then every hour until 1 hour after the transfusion has been completed. When PRBCs are being administered, a 20-gauge or larger needle is needed to avoid destroying the red blood cells passing through the lumen and to allow for maximal flow rate. The nurse is preparing a patient for magnetic resonance imaging. Which action can the nurse delegate to the experienced assistive personnel? 1. Teach the patient what to expect during the test. 2. Instruct the patient to remove metal objects, including zippers. 3. Witness that the patient has signed the consent form. 4. Check and record pre-procedure vital signs. The correct answer is 4. Check and record pre-procedure vital signs. Rationale. The AP scope of practice includes checking and recording patient vital signs. Teaching and instructing, as well as witnessing consent forms, is appropriate to the professional nurse's scope of practice. The AP could remind the patient about the removal of metal objects after the patient receives that instruction.
The client diagnosed with arterial hypertension develops a cold. Which information regarding over-the-counter medications should the nurse teach? 1. Try to find a medication that will not cause drowsiness. 2. OTC medications are not as effective as a prescription. 3. OTC medications are more expensive than prescriptions. 4. Do not take OTC medication unless approved by the HCP. The correct answer is 4. Do not take OTC medication unless approved by the HCP. Many OTC medications work by causing vasoconstriction, which will increase the client's hypertension. The client should only take medications approved by the HCP that will not affect the client's hypertension. The client should be informed about the dangers of self-medicating with OTC medications. Many OTC medications work by causing vasoconstriction, which will increase the client's hypertension. Efficacy of medications depends on the medication and strength. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.